We're live.
Okay, good afternoon, everyone. This is the Delaware County Commissioners Special Meeting. It's Friday, April 24th. The time is 3:09. We had some connectivity issues with some of the folks attending the meeting that we had to get worked out. That's the reason we're late. If any members of the public have questions or comments about the content of this meeting, you may email those to commissioners at COMMISSIONERS at co.delaware, DELAWARE.in.us. That's commissioners at co.delaware.in.us. John, can you call the roll for the commissioners, please?
Sure. Commissioner King.
Here.
Commissioner Reagan.
Present.
Commissioner Henry.
I'm here. Okay, thank you. Jamie Bain, Administrator of the Delaware County Health Department, could you give us an update, please?
Yes, sir. Good afternoon, Commissioners. Jamie Bain, Administrator of the Health Department here. Just a brief update as far as I'm concerned. I believe Dr. Wilkins may have more to add. I've been trying to chase down testing options for COVID-19. ARIA Diagnostics based in Carmel. I had a discussion with one of their owners yesterday. Test kits are available through their company. They run around $3.60 a piece. Testing itself is available as well through their laboratory. It runs around $175 as a cash price. It can also be billed through insurance at no cost to the patient at whatever the insurance reimbursement rate is, which I believe is quite a bit higher than that $150. They stated they have readily available tests. They can have those shipped out. I've requested a sample of one for any local physicians that may want to see it. They do have antibody testing going online here in the very near future after they do some confirmatory testing in-house of their kits that they have brought in. Other than that, that's all I have.
You have your totals for today?
Yeah, we are at 149 cases, still at 11 deaths.
Okay. Thank you, Jamie.
You're welcome.
Dr. Wilkins, the Delaware County Health Officer, could you give us an update, please? You're muted. Your mic's muted, Dr. Wilkins.
Jamie gave you the numbers as of close of business today, and that's correct, 149 and then 11 deaths. We had fewer cases come in today than we have been having, so maybe that's a good thing. I'm not sure how much more testing is being done, but we're still very concerned about nursing homes. That's still, I think, our biggest issue right now is, are we going to see more cases in the nursing homes? I know they are cohorting their positives on wings as they can, and trying to get the state to test the staff to see if there are some asymptomatic carriers that are positive, and at least put those staff taking care of the COVID-19 patients. So that's being done, I believe.
Okay, very good. Does any of the commissioners have questions for members of the health department?
No, I don't.
No.
Okay. So the reason for the meeting is, of course, to discuss the extension of the disaster declaration, which would be number 2020-08. Let me kind of give you an update of what's going on at the county level. I had been working with Charlie to get Shorts Glass in the county building to put up some plexiglass barriers. That has been completed in 2 of the offices. We had a request for some kind of barrier in one of the other offices. Charlie and I discussed that. He did put up a half door. I know we'd had problems with hand sanitizer, and James, you hooked up with a person. Can you talk about that for a second?
Right. It's a company. They're starting to make it now. It's like $60 a gallon to purchase it. They're now actually starting to make it in the bottles, the squeeze bottles. With the way the prices are and everything now, it's like $12 for one of those. I thought about reaching out to some of the adjoining counties and maybe getting with them and doing one big purchase, but I'd like to get with Jason Rogers and sit down and talk to him and find out, how we would turn something like that into FEMA. But it might be a lot better for the surrounding counties to actually work together, to actually start purchasing maybe masks and sanitizer for all of our communities.
I have been working with EMA Director Jason Rogers and trying to obtain masks. We have been able to get some. I've also been working with Bob Jesse at the Highway Department to get some cloth masks. I made comments that we were trying to purchase surgical masks. These masks that we are getting are surgical type masks. We're not trying to keep anything from any of the hospitals or the medical facilities. I got some messages about that last week. They're surgical like masks. I don't think the quality we're getting is actually surgical masks. So I wanted to kind of make that clear. I know, we're all having issues getting even just a regular mask. I ordered some for my police department. They're a cloth mask with a filter on them. And I know I won't be getting those till the middle of next month, or that's the ship day right now. So we're having trouble getting some of that stuff. Jason's looking at some dates of maybe middle of next week to getting some of that stuff in to try to help protect our people and the public. So just the generic cloth mask. I know Bob Jesse has a little over 50 ordered of those, and those are being made as we speak by a local Muncie school teacher who sews on the side. So we're using everybody we can and everything we can to try to obtain some of this equipment for the PPE for our employees. Has anyone got anything to add? John, I know you're working on some masks also with the courts.
Yeah, I've been working with the judges on trying to get some masks. So once they get up and going and start having trials again, which looks like to be the end of May, 1st of June, to have some masks for the litigants and the witnesses, as well as the jurors. And I've been on the phone with Judge Dowling about that very fact. So.
All right. Thank you.
I'd like to ask Dr. Wilkins. So these employees would take their own mask home, and Dr. Wilkins, what do you recommend when they put them in the hot water, little Clorox or what?
Just hot water and a hot dryer will kill the virus.
Okay.
Soap and water will kill it.
Okay, thank you. So the employees would be in charge of taking it home and bringing it back.
That's correct. I've talked to Jason. We'd like to get some spares, of course. If we do that, I would like to keep those up in our office. And if somebody happens to forget a mask or loses their mask or whatever, hopefully we can get enough that we can have a little bit of them in our office, and people can go up to our office and see Jenny and get replacements. That's my goal anyway. We also have, I have EMA, Kyle Johnson actually is working on some floor decals and some decals for the front door. The decals on the floor will remind the public and the employees to stay 6 feet apart, keep a safe distance from each other. The ones on the doors will have a message basically stating that if the person, it's got a stop sign on it, and basically it says if you can conduct business by calling one of the offices, please do so in an effort to keep our people safe and the public safe as well. Jason just popped on. Jason, can you hear me?
Yes, can you hear me, Shannon?
Yeah.
Okay, I've been on for a few minutes. Just didn't want to interrupt you. So with regard to mask, I just want to make one thing clear. As you said, we use the term surgical mask. There are actually multiple ASTM performance levels of different masks. So we're using that term very, very generally. First of all, everybody's familiar now with what N95 is, but maybe not what N95 means. And I'm not going to get into that, but we are not able to source those. Those are 100% going to medical facilities, the hospitals, and long-term care facilities that are dealing with COVID units and those types of patients. So we're not talking about those, not even remotely. With that being said, what masks are available? There's a lot of price gouging going on, and we're working with vetted vendors through the State Department of Homeland Security and trying to make sure that some of these things are being dealt with through nefarious individuals, and they are being held up in customs. And so we're dealing with lots of supply chain issues, and certainly with individuals that are trying to make extra money and get things that are not certified through for our healthcare workers. So it's causing some issues with those supply chains. So we're trying to be very, very diligent with all of our state and federal partners on making sure that those things that we are sourcing are legitimate. That being the case, certainly we put a video out with how to make your own mask out of a t-shirt, and you can't tell the difference between a homemade mask and one of the ones that you can purchase for $14 or $15, certainly in what we're trying to do. Dr. Wilkins, I would defer to you on this comment and just say that what we're trying to do right now is maintain social distancing and encourage people to use masks. So if there are any individuals who are out there who are asymptomatic and they might be a carrier of the disease and not realize that they're shedding, that's why we are using those, or the tactic is to have everyone mask. Do you find that to be correct?
That's correct. Yes, Jason.
Yeah, so that's the purpose. Is there are people that have been medically identified as having being COVID-19 positive, but they don't have any symptoms. So the mask is to protect them as well as you. So that's why we're encouraging those, whether it be a bandana, a homemade mask of cloth type, or some type of dust particulate mask. All of those things, the different masks have different uses and in industry and medical, and there's all kinds of different things. So what we would say is a surgical mask today might be different than what we say is a surgical mask tomorrow. So that being the case, I myself am wearing a cloth mask and have been with all my meetings that are mandatory in dealing with the Indiana National Guard, Department of Homeland Security, and those types of things that we're using, and I've not had any trouble with it. So with that being the case, we are looking for all aspects of what we can provide, what is available, and what is going to be becoming available. And so with that regard, just because we're looking for that stuff doesn't mean we're going to find it. So we need to be ever vigilant in communication with not only our employees but the public as well, and businesses, with what the expectation is and what we're trying to accomplish. That is where we are at today. That's why we're asking everyone to wear a mask when you go out. If you're going into a store, you are protecting yourself and others, and that's what the expectation needs to be. If somebody's not wearing a mask, you shouldn't be looking at individuals and thinking, why do you have a mask on? We should be looking at individuals and saying, why don't you have a mask on if you're in a public building?
Jason, I was watching a news conference this morning, and they had this research that it'll probably be on TV tonight, that they think the virus can hang in the air for 3 hours.
Sherry, I'd be careful with just all the studies. If you show me one study, I can show you another study that's.
I'm sorry, it was on a major network, so.
I'm just
part of it.
I understand. I'm just not willing to. I guess this is such a rapidly evolving situation. I would not necessarily get into what is on a major news network today, because as we have learned, the CDC February 19th said you don't have to wear a mask, and now they're saying everybody needs to wear a mask. So I guess my point to that is, let's before we make any assumptions, or I guess buy all that for gospel, let's wait and see what the experts do say.
Well, it was a research, and I forget what university or who it was, but thank you.
Okay, thank you, Jason. James, you have anything for Jason?
Jason, could you talk a little bit about Kyle Johnson, what he received the other day?
Sure. I'm very, very happy to speak highly of Kyle Johnson. He has been a key member of the EOC staff, basically running not only his GIS responsibilities out of the EOC, but has picked up the slack for us and been a key member of that team, making sure that the information that we're processing, whether it comes and goes to first responders, whether it comes and goes to businesses and those types of things, he is every day working as the logistics section chief, as well as his responsibilities to GIS. So I can't thank him enough for his efforts, and he spent a lot of long days with us in the EOC. That being said, the coronavirus hub that we have created and all the information has been spotlighted on the ERSI website as nationally recognized as one of the government agencies who are using that GIS data for COVID-19 response and information sharing. So it is now on the front page of their website nationally, and Kyle was recognized for his contribution to this response. So we are very pleased in having Delaware County be represented by Kyle, and certainly the Emergency Management Office couldn't be nearly as effective without Kyle being on our team.
And I just want to say thank you to you and Kyle, both. Jason, you guys do a great job, and I'm glad we have both of you here at Delaware County. So thank you.
Thank you. We certainly appreciate that. Kyle's sitting in my office right now.
All right.
Appreciate the team you put together.
Yeah, thanks, you guys.
Thank you, commissioners.
Shannon,
Yes.
do you want me to check with some suppliers and see whether they can get, last time I talked to you, anyway, I told you I could do that. Do you want me to go ahead and check and see if they can get disposable masks, and while I'm at it, any sanitizer?
Yeah, why don't you coordinate that with Jason, because I know we already have some on order. So
Okay.
coordinate that
I'll just get him some availability and pricing, and you guys, if you need more in the future or if you need more now.
Absolutely.
Okay.
It's going to be, we need some now, but I think we're also going to need some for the future as well. So, and I think everybody realizes that, but. Okay, with the extension of the disaster declaration, I know we have, there is several offices in the county building that has continued to work through this, of course. The clerk's office right now is very busy because of the upcoming election. They have several people in there, but I don't feel comfortable saying, let's bring every single person back to the building. As of yet, I just don't think, with the numbers, what we've been seeing in the numbers, even though we're down a little bit today, I would rather myself, I think we ought to wait another week. Dr. Wilkins, what's your feeling on that?
You're muted, Don.
I think we do need to wait another week.
Okay.
Shannon, if I may, the other thing I'd like to say is there are efforts in place. I had my first visit to the county building yesterday in the last, well, since what, April? No, March 13th. So I have noticed that offices are social distancing. Many of the offices have stops at their front door that will not allow anybody into their office. They are taking precautions for cleaning with the limited staff that is there. And another week would be good. And I'll tell you why. We are also seeing implementations of barriers being put in. As an example, the treasurer's office put in plexiglass barriers across all of their tellers' desks. So as those things continue to be implemented, when we're fully ready, I think that we'll have all of those things in place. It just takes a little time. So appreciate that thought.
Yeah, I agree. I spoke with another department head today. Also spoke with Charlie. We have some other, I think we're going to put up some chain barriers in some of the offices. So we have more work to do.
And
Go ahead, Sherry.
I suppose we could have security kind of eyeball it too, instead of having them line up down our hallways, leave them outside until bring them in.
Yeah, I agree. And I still think that once we get everybody back in the building, I think that we should let our employees get things, get acclimated maybe to the fact that they're going to have social distance as well. And I think before we open up to the public, I think we'll have our employees back in there for at least a week. It's kind of my feeling.
I was kind of wondering when we closed, it was by appointment, how that worked. Have you heard pros and cons of that?
I haven't, but that's kind of what the stickers on the front doors are gonna be is kind of asking people to make appointments to get up there and get their business taken care of. Unlike before where people just walk in and ask questions and walk around the building. We definitely want the public taken care of, but we also want everybody to do it in a safe manner. So what's your commissioners, what's your thoughts on the extension of the declaration?
I'll make a motion that we approve it.
Second.
We have a motion to approve extension until next Friday, which I believe is that the date is that?
May 1st.
May 1st.
Yes, and there it is. Emergency, I've got it shared up 2028. The only addition was paragraph 8 about encouraging and people should wear masks when going out to essential businesses or grocery stores or outside their residences for any essential purpose. So you're reiterating that, which is.
So we have a motion and a second. John, could you call the roll?
Sure. Commissioner King,
Yes.
Commissioner Riggin,
Yes.
Commissioner Henry.
Yes.
It's
Okay, very good. Thank you. Does any commissioners have anything else?
No, not this time.
No, I don't.
Does anybody else have a comment?
Nothing else.
All right, I would like to thank everybody for this afternoon. Everybody have a good weekend.
Well, I
Thank you.
need a motion to recess.
I'll make a motion to recess.
Second.
Okay, we have a motion to recess and a second. John, call the roll.
Commissioner Riggin,
Yes.
Commissioner King,
Yes.
Commissioner Henry.
Yes.
All right, thank you.
Thank you, everybody.
Thank you.
Thank you.